Hi, my name is Megan Hansen. I'm the Director of Member Relations and Benefits with the North Dakota Farm Bureau, and today I'm actually talking with Dan and asking him a few questions about AgriPlan. Dan, if you'd like to introduce yourself.
Yes, Dan Pavek with Task. I've been a North Dakota resident working with Task for the last 15 years. So happy to be here today and answer any questions I can, Megan.
Yeah, our members have asked us a couple questions that I figured it'd be nice if we go over so everybody can kind of get the feel of all of our member benefits.
Absolutely.
So how exactly does AgriPlan work?
It's a great question. And for most people, it's a family farm, husband and wife type business where they've got an employable spouse. And it actually puts them in a situation where they can take things like health insurance and their out-of-pocket medical expenses and actually treat them as a legitimate farm expense. No different than feed, seed, or fertilizer that they would have for everyday farming expenses.
Oh, perfect. So if I'm self-employed, can't I already deduct my health insurance?
That's another great question. So as a self-employed individual, your health insurance premiums are deductible, but they're deducted on a 1040, the same place that property taxes and mortgage interest are deducted. So your current situation, if you pay for health premiums, would be that you're saving state and federal income tax. And when we set up AgriPlan, we're able to pick up FICA. So things like self-employment, Medicare, and Social Security that aren't saved with standard deductions are picked up and as a result saved with AgriPlan.
So my spouse carries the family health insurance through her employer. Does AgriPlan still work for us?
So in most cases, if the spousal insurance or the spouse carries the health plan for the family, what's going to happen there is that if they are paying for anything, for example, a lot of employers will cover a full individual policy and then they might have to pick up an extra payroll deduction for a family plan, that's already going to be taken as a pre-tax deduction. So you wouldn't also be able to get reimbursed through the farm. However, just because you've got spousal coverage doesn't mean that AgriPlan still wouldn't work for things like out-of-pocket medical expenses.
Okay, so like a doubled up insurance form.
Correct.
Perfect.
Yep.
Can I use AgriPlan if I have multiple employees?
Yes, it's not going to be the traditional AgriPlan. A lot of farmers are starting to have full-time, hired men, things like that, and they're having a hard time to attract and retain those employees. So a lot of times we're seeing AgriPlan used today to do things like, instead of just grossing up wages, they'll give them $300 a month or $500 a month to help them pay for their own family's health insurance. And when you do that through AgriPlan, it's going to be tax-free.
What deductions will qualify using AgriPlan?
So it's anything from your health insurance, and that could be things like a standard Blue Cross and Blue Shield. It could be insurance through the marketplace. It could be Medicare. It could even be things like health sharing plans. Those are starting to become a little bit more popular. And by having AgriPlan, it's going to put your family in a situation to take a better deduction on those health premiums. Not to mention things like long-term care policies, cancer policies, hospital indemnity, and of course all the out-of-pocket expenses like vision, dental, chiropractor, prescription drugs, things like co-pays, deductibles. All of those are kind of bundled into one and qualify as a full farm deduction when utilizing AgriPlan.
That sounds great. So is AgriPlan a funded account, or do I need to change my health insurance to qualify?
It's not a funded plan. It's simply a reimbursement arrangement between the farm and the employees of that farm. So again, a lot of times in like a mom and pop type situation, let's just say husband owns the farm, wife is going to become the employee of that farm. Maybe the spouse is getting $100 a month, just needs to generate a W-2 wage, and then you now have a qualifying employee in which to reimburse for things like health insurance. So kind of the fundamentals behind it, the health insurance premiums, the out-of-pocket expenses are all paid for out of a personal account, and then very simply reimbursed from the farm once per month. By having that reimbursement take place, that's what enables us to take the employee benefit deduction at the end of the year.
That's really good information to know, especially for all of our small farmers that we have in North Dakota. I'm sure
Absolutely.
They would love to use this.
Yep.
Do I have to be married to qualify?
You do if you're filing a Schedule F. So if you're a sole proprietorship, the bottom line here is we're taking advantage of an employee benefit deduction. You have to have an employee in order to qualify for that deduction. So if you're a single Schedule F filer, there is no W-2 there. If you have that employable spouse, that's where you pick up the employee. That spousal employee can cover themselves plus dependents, which includes the employer and any dependent children. So it is kind of a key component unless you're incorporated. If you're incorporated, then you may be drawing a W-2 wage anyways. So in some cases you could still qualify, but most of what I see with North Dakota farmers is it's the employable spouse that is kind of the critical component.
Okay, so the main point is you need to get a W-2.
Yes, there needs to be an employee in order to take employee benefit deductions.
That sounds great. Well, I think that's all of my questions for today. So
Okay.
I really appreciate you coming and helping us out, answering some questions for our members, and thank you.
Absolutely. Look forward to working with everyone.